NCLEX Delegation questions. Question 1. Assisting the patient with oral hygiene. Observing the patient's response to feedings. Facilitating expression of grief or anxiety. Initiating daily weighings. Oral hygiene is within the scope of duties of the UAP. It is the responsibility of the nurse to observe response to treatments and to help the patient deal with loss or anxiety. The UAP can be directed to weigh the patient but should not be expected to know when to initiate that measurement. Focus, delegation. Question 2. When care assignments are being made for patients with alterations related to gastrointestinal, GI, cancer, which patient would be the most appropriate to assign to an LPN/LVN under the supervision of a team leader RN? 1. A patient with severe anemia secondary to GI bleeding. 2. A patient who needs enemas and antibiotics to control GI bacteria. A patient who needs preoperative teaching for bowel resection surgery. A patient who needs central line insertion for chemotherapy. Administering enemas and antibiotics is within the scope of practice of LPNs/LVNs. Although some states and facilities may allow the LPN/LVN to administer blood, in general, administering blood, providing preoperative teaching, and assisting with central line insertion are the responsibilities of the RN. Focus, assignment. Question 3. Start oxygen at 4L/min using a nasal cannula. Obtain 4 access with a large bore 4 catheter. Give epinephrine, adrenaline, 0.3 ml intramuscularly. Administer 3 ml of nebulized albuterol, Prevental, 0.083%. Epinephrine is the initial drug of choice for treatment of anaphylaxis. Giving epinephrine rapidly at the onset of an anaphylactic reaction may prevent or reverse cardiovascular collapse as well as airway narrowing caused by bronchospasm and inflammation. Oxygen use is also appropriate, but oxygen would be administered using a non-rebreather mask in order to achieve a fraction of inspired oxygen closer to 100%. Albuterol may also be administered to decrease airway narrowing but would not be the first therapy used for anaphylaxis. 4 access will take longer to establish and should not be the first intervention. Focus, prioritization. Question 4. Suggesting that the patient should order chili con carne or chicken soup for the next meal. Placing a no visitors sign on the door of the patient's room. Nystatin should be in contact with the oral and esophageal tissues as long as possible for maximum effect. The other actions are also inappropriate and should be discussed with the student but do not require action as quickly. HIV-positive patients do not require droplet/contact precautions or visitor restrictions to prevent opportunistic infections. Hot or spicy foods are not usually well tolerated by patients with oral or esophageal fungal infections. Focus, prioritization. Question 5. Blood glucose level is 55 mg/dl after medication administration. Pentamidine can cause fatal hypoglycemia, so the low blood glucose level indicates a need for a change in therapy. The low blood pressure suggests that the pentamidine infusion rate may need to be slowed. The other responses indicate a need for independent nursing actions, such as establishing a new site and encouraging oral intake, but are not associated with pentamidine infusion. Focus, prioritization. Question 6. Administering 4 fluids as prescribed by the physician. 2. Providing straws and offering fluids between meals. Developing a plan for added fluid intake over 24 hours. 4. Teaching family members to assist the client with fluid intake. UAPs can reinforce additional fluid intake once it is part of the care plan. Administering 4 fluids, developing plans, and teaching families require additional education and skills that are within the scope of practice of an RN. Focus, delegation, supervision. Question 7. Observing the lips, tongue, and mucous membranes. 4. Providing mouth care every 2 hours while the client is awake. Seeking a dietary consult to increase fluids on meal trays. The LPN/LVN scope of practice and educational preparation includes oral care and routine observation. State practice acts vary as to whether LPNs/LVNs are permitted to perform assessment. The client should be reminded to avoid most commercial mouthwashes, which contain alcohol, a drying agent. Initiating a dietary consult is within the purview of the RN or physician. Focus, delegation, supervision. Question 8. Remove gloves. Take off gown. Perform hand hygiene. Underscore 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 underscore. This sequence will prevent contact of the contaminated gloves and gown with areas, such as your hair, that cannot be easily cleaned after client contact and stop transmission of microorganisms to you and your other clients. The correct method for donning and removal of personal protective equipment, PPE, has been standardized by agencies such as the CDC and the Occupational Safety and Health Administration. Focus, prioritization. Question 9. You are working as the triage nurse in the ED when the following 4 clients arrive. Which client requires the most rapid action to protect other clients in the ED from infection? 3-year-old who has paroxysmal coughing and whose sibling has pertussis. 5-year-old who has a new pruritic rash and a possible chickenpox infection. 62-year-old who has a history of a methicillin-resistant Staphylococcus aureus, MRSA, abdominal wound infection. 74-year-old who needs tuberculosis, TB, testing after being exposed to TB during a recent international airplane flight. Varicella, chickenpox, is spread by airborne means and could be rapidly transmitted to other clients in the ED. The child with the rash should be quickly isolated from the other ED clients through placement in a negative pressure room. Droplet and/or contact precautions should be instituted for the clients with possible pertussis and MRSA infection, but this can be done after isolating the child with possible chickenpox. The client who has been exposed to TB does not place other clients at risk for infection because there are no symptoms of active TB. Focus, prioritization. Question 10. Auscultating breath sounds. Administering medications via metered dose inhaler, MDI. Completing in-depth admission assessment. Checking oxygen saturation using pulse oximetry. Developing the nursing care plan. The experienced LPN/LVN is capable of gathering data and making observations, including noting breath sounds and performing pulse oximetry. Administering medications, such as those delivered via MDIs, is within the scope of practice of the LPN/LVN. Independently completing the admission assessment, developing the nursing care plan, and evaluating a patient's abilities require additional education and skills within the scope of practice of the professional RN. Question 11. Provide the patient with an extra pillow. Have the patient sit up in a chair at the bedside. When the oxygen flow rate is higher than 4L/min, the mucous membranes can be dried out. The best treatment is to add humidification to the oxygen delivery system. Applying water-soluble jelly to the nares can also help decrease mucosal irritation. None of the other options will treat the problem. Focus, prioritization. Question 12. Replacing the inner cannula and cleaning the stoma site. When tracheostomy care is performed, a sterile field is set up and sterile technique is used. Standard precautions such as washing hands must also be maintained but are not enough when performing tracheostomy care. The presence of a tracheostomy tube provides direct access to the lungs for organisms, so sterile technique is used to prevent infection. All of the other steps are correct and appropriate. Focus, delegation, supervision. Question 13. Instruct the patient not to blow the nose for several hours. The correct position for a patient with an anterior nosebleed is upright and leaning forward to prevent blood from entering the stomach and to avoid aspiration. All of the other instructions are appropriate according to best practice for emergency care of a patient with an anterior nosebleed. Focus, delegation, supervision, assignment. Question 14. Administering morphine sulfate 4 mg for. Obtaining a 12-lead electrocardiogram, ECG. Asking the client about pertinent medical history. Having the client chew and swallow aspirin 162 mg. Attaching cardiac monitor leads, obtaining an ECG, and administering oral medications are within the scope of practice for LPN/LVNs. An experienced LPN/LVN would be familiar with these activities. Although anticoagulants and narcotics may be administered by LPNs/LVNs to stable clients, these are high-alert medications that should be given by the RN to this unstable client. Obtaining a pertinent medical history requires RN-level education and scope of practice. Focus, delegation. Question 15. Starting in 4-line for the transfusion using a 22-gauge catheter. Priming the transfusion set using 5% dextrose in lactate Ringer's solution. Telling the patient that the PRBCs may cause a serious transfusion reaction. Normal saline, an isotonic solution, should be used when priming the 4-line to avoid causing hemolysis of red blood cells, RBCs. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large bore 4 catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new RN should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the 4 tubing. Focus, prioritization. Question 16. Checking for allergies to contrast dye or shellfish. An experienced UAP will have been taught how to obtain a stool specimen for the Hemocult slide test, because this is a common screening test for hospitalized patients. Having the patient sign an informed consent form should be done by the physician who will be performing the colonoscopy. Administering medications and checking for allergies are within the scope of practice of licensed nursing staff. Focus, delegation. Question 17. As charge nurse, you are making the daily assignments on the medical surgical unit. Which patient is best assigned to a float nurse who has come from the post-anesthesia care unit, PACU? 30-year-old patient with thalassemia major who has an order for subcutaneous infusion of deferoxamine, Desferal. 43-year-old patient with multiple myeloma who requires discharge teaching. 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. 65-year-old patient with pernicious anemia who has just been admitted to the unit. A nurse who works in the PACU will be familiar with the monitoring needed for a patient who has just returned from a procedure such as a colonoscopy, which requires conscious sedation. Care of the other patients requires staff with more experience with various types of hematologic disorders and would be better to assign to nursing personnel who regularly work on the medical surgical unit. Focus, assignment. Question 18. Taking the client's vital signs. Restraining the client for protection. Measurement of vital signs is within the education and scope of practice of UAPs. The nurse should perform neurologic checks and document the seizure. Clients with seizures should not be restrained. However, the nurse may guide the client's movements if necessary. Focus, delegation, supervision. Question 19. Patting the side rails before the client arrives. The LPN/LVN can set up the equipment for oxygen and suctioning. The RN should perform the complete initial assessment. Controversy exists as to whether padded side rails actually provide safety, and their use may embarrass the client and family. Tongue blades should not be at the bedside and should never be inserted into the client's mouth after a seizure begins. Focus, delegation, supervision. Question 20. Assessing nutritional factors for a client with age-related macular degeneration. Reviewing the health history of a client to identify risk for ocular manifestations. Performing a routine check of a client's visual acuity using the Snellen eye chart. Administering medications, reviewing and demonstrating standard procedures, and performing standardized assessments with predictable outcomes in non-complex cases are within the scope of the LPN/LVN. Assessing for systemic manifestations and behaviors, risk factors, and nutritional factors is the responsibility of the RN. Focus, delegation. Question 21. Identifying environmental factors that increase risk for falls. monitoring gait, balance, and fatigue level with ambulation, collaborating with the physical therapist, point, to provide the patient with a walker, assisting the patient with ambulation to the bathroom and in the halls, assisting with activities of daily living, ADLS, is within the scope of the UAP's practice. The other three interventions require additional educational preparation and are within the scope of practice of licensed nurses. Focus, delegation, supervision. Question 22. Reminding the patient to drink milk and eat cottage cheese. Applying heat, not ice, is the appropriate measure to help reduce the patient's pain. Ibuprofen is useful to manage mild to moderate pain. Exercise prescribed by the point would be non-impact in nature and provide strengthening for the patient. A diet rich in calcium promotes bone health. Focus, delegation, supervision. Question 23. As charge nurse, you are making assignments for the day shift. Which patient would you assign to the nurse who was floated from the post-anesthesia care unit, PACU, for the day? 35-year-old with osteomyelitis who needs teaching before hyperbaric oxygen therapy. 62-year-old with osteomalacia who is being discharged to a long-term care facility. 68-year-old with osteoporosis given a new orthotic device whose knowledge of its use must be assessed. 72-year-old with Paget disease who has just returned from surgery for total knee replacement. The PACU nurse is very familiar with the assessment skills necessary to monitor a patient who just underwent surgery. For the other patients, nurses familiar with musculoskeletal system-related nursing care are needed to provide teaching and assessment, and prepare a report to the long-term care facility. Focus, assignment. Question 24. Explaining the need for a clear liquid diet 1 to 3 days before the procedure. Reinforcing nothing by mouth status 8 hours before the procedure. Administering laxatives 1 to 3 days before the procedure. Administering an enema the night before the procedure. The UAP can reinforce dietary and fluid restrictions after the RN has explained the information to the client. It is also possible that the UAP can administer the enema, however, special training is required, and policies may vary among institutions. Medication administration should be performed by licensed personnel. Focus, delegation. Question 25. Assessing the patient's insulin injection technique. Teaching the patient to use a glucometer to monitor glucose at home. Reminding the patient to check glucose level before each meal. The UAP's role includes reminding patients about interventions that are already part of the plan of care. Arranging for a consult with the dietitian is appropriate for the unit clerk. Teaching and assessing require additional education and should be carried out by licensed nurses. Focus, delegation, supervision, assignment. Question 26. Bunion on the left great toe. Profuse perspiration is a symptom of hypoglycemia, a complication of diabetes that requires urgent treatment. A glucose level of 185 mg/dl will need coverage with sliding scale insulin, but this is not urgent. Numbness and tingling, as well as bunions, are related to the chronic nature of diabetes and are not urgent problems. Focus, prioritization. Question 27. The plan of care for a diabetic patient includes all of these interventions. Which intervention should you delegate to a UAP? Checking to make sure that the patient's bath water is not too hot. Discussing community resources for diabetic outpatient care. Teaching the patient to perform daily foot inspection. Assessing the patient's technique for drawing insulin into a syringe. Checking the bath water temperature is part of assisting with activities of daily living and is within the education and scope of practice of the UAP. Discussing community resources, teaching, and assessing require a higher level of education and are appropriate to the scope of practice of licensed nurses. Focus, delegation. Question 28. Decreased systolic blood pressure, increased respiratory rate, decreased oral temperature. The cardiac problems associated with hyperthyroidism include tachycardia, increased systolic blood pressure, and decreased diastolic blood pressure. Patients with hyperthyroidism also may have increased body temperature related to increased metabolic rate. Respiratory changes are usually not symptomatic of this condition. Focus, delegation, supervision. Question 29. Drawing blood to measure levels of thyroid-stimulating hormone, triiodothyronine, and thyroxine. Teaching the patient about side effects of the drug propylthiouracil. Monitoring vital signs and recording their values are within the education and scope of practice of UAPs. An experienced UAP should have been taught how to monitor the apical pulse. However, a nurse should observe the UAP to be sure that the UAP has mastered this skill. Instructing and teaching patients, as well as performing venipuncture to obtain laboratory samples, are more suited to the education and scope of practice of licensed nurses. In some facilities, an experienced UAP may perform venipuncture, but only after special training. Focus, delegation, supervision, assignment. Question 30. 49-year-old with Cushing disease and dependent edema rated as 1+. Although patients with hypothyroidism often have cardiac problems that include bradycardia, a heart rate of 48 beats/min may have significant implications for cardiac output and hemodynamic stability. Patients with Graves' disease usually have a rapid heart rate, but 94 beats/min is within normal limits. The diabetic patient may need sliding scale insulin dosing. This is important but not urgent. Patients with Cushing disease frequently have dependent edema. Focus, prioritization. Question 31. A patient is hospitalized with adrenocortical insufficiency. Which nursing activity should you delegate to a UAP? Reminding the patient to change positions slowly. Assessing the patient for muscle weakness. Teaching the patient how to collect a 24-hour urine sample. Revising the patient's nursing plan of care. Patients with hypofunction of the adrenal gland often have hypotension and should be instructed to change positions slowly. Once a patient has been so instructed, it is appropriate for the UAP to remind the patient of those instructions. Assessing, teaching, and planning nursing care require more education and should be done by licensed nurses. Focus, delegation, supervision. Question 32. Teaching the client about risk factors for squamous cell carcinoma. Showing the client how to care for the surgical site at home. Monitoring the surgical site for swelling, bleeding, or pain. Discussing the reasons for avoiding aspirin use for a week after surgery. An LPN/LVN who is experienced in working with postoperative clients will know how to monitor for pain, bleeding, or swelling and will notify the supervising RN. Client teaching requires more education and a broader scope of practice and is appropriate for RN staff members. Focus, delegation. Question 33. You are employed as the charge nurse in a long-term care (LTC) facility that employs RNs, LPNs/LVNs, and UAPs. When you are planning care for a resident with a stage 3 sacral pressure ulcer, which nursing intervention is best to delegate to an LPN/LVN? Choosing the type of dressing to be used on the ulcer. 2. Using the Norton scale to assess for pressure ulcer risk factors. Assisting the client in changing position at frequent intervals. Cleaning and changing the dressing on the ulcer every morning. LPN/LVN education and scope of practice includes sterile and non-sterile wound care. LPNs/LVNs do function as wound care nurses in some LTC facilities, but the choice of dressing type and assessment for risk factors are more complex skills that are appropriate to the RN level of practice. Assisting the client to change position is a task included in UAP education and would be more appropriate to delegate to the UAP. Focus, delegation. Question 34. Client who has just been transferred from the post-anesthesia care unit after having skin grafts applied to the anterior chest. Client admitted 3 weeks ago with full-thickness leg and buttock burns who has been waiting for 3 hours to receive discharge teaching. Facial burns are frequently associated with airway inflammation and swelling, so this client requires the most immediate assessment. The other clients also require rapid assessment or interventions, but not as urgently as the client with facial burns. Focus, prioritization. Question 35. You are the nurse manager in the burn unit. Which client is best to assign to an RN who has floated from the oncology unit? 23-year-old who has just been admitted with burns over 30% of the body after a warehouse fire. 36-year-old who requires discharge teaching about nutrition and wound care after having skin grafts. 45-year-old with infected partial thickness back and chest burns who has a dressing change scheduled. 57-year-old with full thickness burns on both arms who needs assistance in positioning hand splints. A nurse from the oncology unit would be familiar with dressing changes and sterile technique. The charge RN in the burn unit would work closely with the float RN to provide partners to assist in providing care and to answer any questions. Admission assessment and development of the initial care plan, discharge teaching, and splint positioning in burn clients all require expertise in caring for clients with burns. These clients should be assigned to RNs who regularly work on the burn unit. Focus assignment. Question 36. Teaching the patient how to secure a clean catch urine sample. Assessing the patient's urine for color, odor, and sediment. Reviewing the nursing care plan and add nursing interventions. Providing the patient with a clean catch urine sample container. Providing the equipment that the patient needs to collect the urine sample is within the scope of practice of a UAP. Teaching, planning, and assessing all require additional education and skill, which is appropriate to the scope of practice of professional nurses. Focus, delegation, supervision. Question 37. 72-year-old with urinary incontinence who needs bladder training. 52-year-old with pyelonephritis who has severe acute flank pain. The patient with cystitis who is taking oral antibiotics is in stable condition with predictable outcomes, and caring for this patient is therefore appropriate to the scope of practice of an LPN/LVN under the supervision of an RN. The patient with a new order for lithotripsy will need teaching about the procedure, which should be accomplished by the RN. The patient in need of bladder training will need the RN to plan this intervention. The patient with flank pain needs careful and skilled assessment by the RN. Focus assignment. Question 38. Communicating the client's status report to the charge nurse on the surgical unit. Teaching the client about the importance of using pain medication as needed. An LPN/LVN working in a PACU would be expected to check dressings for bleeding and alert RN staff members if bleeding occurs. The other tasks are more appropriate for nursing staff with RN-level education and licensure. Focus, delegation. Question 39. Reinforcing the dressing if it becomes saturated. Positioning the client's arm is a task within the scope of practice for UAP working on a surgical unit. Client teaching and assessment are RN-level skills. The RN should reinforce dressings as necessary, because this requires assessment of the surgical site and possible communication with the surgeon. Focus, delegation. Question 40. Removing the adhesive skin closure strips of a patient who had a cesarean section 2 weeks ago. Giving community resource information and emergency numbers to a prenatal patient whom you suspect is experiencing domestic violence. Dispensing a breast pump with instruction to a lactating patient having trouble with milk supply 4 weeks postpartum. The UAP can check the blood pressure of this patient and report it to the RN. The RN would include this information in her full assessment of the patient, who may be showing signs of preeclampsia. The other tasks listed require nursing assessment, analysis, and planning, and should be performed by the RN. Provision of accurate and supportive education about breastfeeding and breast pumping supports the perinatal core measure of increasing the percentage of women who exclusively breastfeed. Focus, delegation. Question 41. A 32-year-old G4P3 woman at 27 weeks gestation who noted vaginal bleeding today following intercourse. A 27-year-old G2P1 woman at 37 weeks gestation who experienced spontaneous rupture of membranes 30 minutes ago but feels no contractions. A multiparous patient in active labor with an urge to have a bowel movement will probably give birth imminently. She needs to be the first assessed, the provider must be notified immediately, and she must be moved to a safe location for the birth. She should not be allowed up to the bathroom at this time. The other patients all have needs requiring prompt assessment, but the imminent birth takes priority. Vaginal bleeding after intercourse could be due to cervical irritation or a vaginal infection, or could have a more serious cause such as placenta previa. This patient should be the second one assessed. Focus, prioritization. Question 42. Child who needs pre-medication before reduction of a fracture. The child has been crying and is resistant to any touch to the arm or other procedures. Child who is receiving palliative end-of-life care. The child is receiving narcotics around the clock to relieve suffering, but there is a progressive decrease in alertness and responsiveness. Child who has chronic pain and whose medication and non-pharmacologic regimen has recently been changed. The mother is anxious to see if the new regimen is successful. The set of circumstances is least complicated for the child with the fracture, and this would be the best patient for a new and relatively inexperienced nurse. The child is likely to have a good response to pain medication, and with gentle encouragement and pain management the anxiety will resolve. The other 3 children have more complex social and psychological issues related to pain management. Focus, delegation. Question 43. An 8-year-old child has stomatitis secondary to chemotherapy. Which task would be best to delegate to the UAP? Reporting evidence of severe mucosal ulceration. Assisting the child in swishing and spitting an anesthetic mouthwash. Assessing the child's ability and willingness to drink through a straw. Helping the patient to eat a bland, moist, soft diet. Helping the patient to eat is within the scope of responsibilities for a UAP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration is the responsibility of an RN. Plain water or saline rinses are preferable if the child cannot gargle or spit out fluids. The RN should assess and administer oral preparations as needed. Focus, delegation. Question 44. An advanced practice nurse and an experienced LPN/LVN. An experienced LPN/LVN and an inexperienced RN. An experienced RN and an inexperienced RN. An experienced RN and an experienced UAP. Triage requires at least one experienced RN. Pairing an experienced RN with an inexperienced RN provides opportunities for mentoring. Advanced practice nurses are qualified to perform triage, however, their services are usually required in other areas of the ED. An LPN/LVN is not qualified to perform the initial client assessment or decision-making. Pairing an experienced RN with an experienced UAP is the second best option, because the UAP can measure vital signs and assist in transporting. Focus, assignment. Question 45. Irritable infant with a fever, petechiae, and nuchal rigidity. 35-year-old jogger with a twisted ankle who has a pedal pulse and no deformity. 50-year-old woman with moderate abdominal pain and occasional vomiting underscore 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 underscore. An irritable infant with fever and petechiae should be further assessed for other signs of meningitis. The client with the head wound needs additional history taking and assessment for intracranial pressure. The client with moderate abdominal pain is in discomfort, but her condition is not unstable at this point. For the ankle injury, medical evaluation could be delayed up to 24 to 48 hours if necessary, but the client should receive the appropriate first aid. Focus, prioritization. Question 46. Female RN assigned to a newly admitted female patient who has command hallucinations and delusions of persecution. Older female RN with medical surgical experience assigned to a male patient with Alzheimer's disease. Teenagers, in general, are self-conscious in the presence of members of the opposite sex, and teens with anorexia are overly concerned with their appearance. Therefore, it would be better to assign this patient to a mature female staff member. An experienced LVN, regardless of gender pairing, is able to set boundaries and to assist patients with chronic health problems. An experienced RN should be assigned to new admissions, particularly if there are acute safety issues. An RN with medical surgical experience would be well acquainted with care issues related to dementia. Focus, assignment. Question 47. There is a patient on the medical surgical unit who has been there for several months. He is hostile, rude, and belligerent, and no one likes to interact with him. How should you handle the assignment? Rotate the assignment schedule so that no one has to care for him more than once or twice a week. Pair a float nurse and a nursing student and assign the patient to that team because they will have a fresh perspective toward the patient. Identify 2 or 3 experienced nurses as primary caregivers and develop a plan that includes psychosocial interventions. Assign yourself as primary caregiver so that you can role model how patients should be treated. This patient has trouble with interpersonal interactions, so consistent caregivers who use psychosocial interventions have the best chance of being able to develop a relationship with this difficult individual. Rotating the assignment sheet to give the staff a break and using float staff are frequent strategies that are employed, but these are not necessarily the best for the patient. Taking the patient yourself may seem like the easiest solution, but in the long run, strengthening and supporting the staff are better strategies than trying to do all of the hard tasks yourself. Focus assignment.